And I have talked with doctors who, they do autologous stem cell therapy, they do adipose procedures, and they've had some failures and more failures than other colleagues in the space. And I get talking with them. Being like, okay, well, what did you treat? And they're like, well, the patient had osteoarthritis of the hip, so I put it inside the hip joint. And it's like, did you treat anything else? And they're like, no, they have osteoarthritis of the hip. It just like completely spaces some of these doctors that there can be more going on with a patient's pain than just what you find on imaging, right? And if you've been listening to me for any length of time, I have been drilling home this concept of that you can't see pain on imaging. You can see structures that could be painful, but you're not seeing pain, right? And so the approach that I take in the regenerative medicine space, it doesn't matter what substance I use. It doesn't matter if I use dextrose, PRP, an amniotic allograft, or autologous stem cells. The approach is what we call a prolotherapy approach, where we are finding the pain generators with our hands, with our orthopedic testing, and then finally with our needle, because finding the pain generators with the needle is a really important part of this process. And we are treating all of those areas. That means that injection numbers are going to be a little bit higher for each procedure, right? And so an example is I recently treated a woman for low back pain, hip pain, and knee pain. And between all of those three structures, there was probably about 20 different actual structures that got treated, whether that was a tendon insertion onto the bone, a ligament insertion onto the bone, a joint space, a nerve, a fat pad, right? And then within those 20 different actual structures, there were 2 to 4 different little locations within those structures that we treated, right? So we call this kind of a peppering technique where if this is the whole area of the tendon insertion onto bone, I'm not just coming in one place and putting it here. I'm kind of peppering all over the place here and putting little aliquots of the solution in those areas to have a more broad effect, to affect more tissue, to get better results. And so that's kind of the approach that I take with my patients. That's what I teach to my students, what I teach to other doctors that I train, and why I think that this approach is getting better results than a lot of other places out there.